school board meeting, but it has been updated just to reflect current COVID data and just to be available to you as you engage and ask questions in a live format tonight. So we welcome questions from all participants who join us. If you'd like to ask a question, please send it through the Q&A box, which is at the bottom of your screen on this webinar. And we'll address those questions after the presentation is complete, after Dr. McLaughlin's presentation. Those questions will be addressed live and answered live here tonight. We'll also be keeping our COVID-19 website updated continuously. So any questions that come to us with any frequency will be added to the website as well. We have, I believe, disabled chat at least to the panelists tonight, but that Q&A function is available to you. And as we move forward, we do have Paula Potts, who is offering Spanish translation for the session. So if you need that service, there's a button at the bottom of your screen. It says interpretation. So you can access that feature now, and that will enable a Spanish translation for you of this session in live format. We will end tonight's session at 7:15 sharp. So if you have any further questions for us, please feel free to email me, Helen Dunn, again, at hdunn@k12albemarle.org. Again, hdunn@k12albemarle.org, and I will try to respond to all questions as I get them. So Dr. Vergales, if you want to just take a second, we would really appreciate it. Thanks so much.
Absolutely. And Helen, make sure everything is coming through fine and you can hear me okay?
You sound great. Yeah.
All right, perfect. So welcome, guys. And again, thank you very much to the folks over at Albemarle County and the superintendent's office and kind of the COVID task force for allowing me to just kind of be a small part of this. I'm a pediatrician at the University of Virginia. I'm also a pediatric cardiologist, which is my area of subspecialty. But my other hat that I wear is in public health data, and that's kind of how I've been roped into this over the last kind of now almost approaching a year and a half, almost 2 years. And it's been an absolute pleasure working with this group. I have 2 children in the district. Both are in elementary school at Stone Robinson. So I remain both personally and professionally very committed to everybody here. I will just kind of lead off for 1 minute to say, you know, obviously we realized that last year was a year that we'd love to never go back to. You know, what school looked like last year compared to what school is going to look like this year is incredibly different. But we did learn a lot of lessons from last year. And one of the things that we found is that schools were not the epicenter of spread during this pandemic. We have that proven both within our own district, where we found that while we did have cases within the school, just like we would have cases within the community, we did not have appreciable high numbers of secondary spread that was feared during the time of the fall. The other thing that we found is we found both without other states in this country and in other countries that we found very similar findings. And so paper after paper and manuscript after manuscript have continued to come out and have demonstrated that truly schools can actually be a very safe place for kids. It is a very controlled environment compared to extracurricular and outside of family events. And that is where we have found that we've been able to be the best at actually controlling spread. The folks here have worked on lots of mitigation strategies, of which you're going to hear many about tonight. Those include combinations of how we do physical distancing, how we do masking, how we do isolation and quarantine. And I promise you that all of these things have been thought out with both a very progressive take on the data. So we are actually trying to push the envelope as best as we can, with an also understanding of how we work with the Blue Ridge Health District. But please rest assured that everything that we are doing is with the intent of keeping kids in school as much as possible. Every single mitigation strategy is designed around that fact. And that is always very important when we talk about what the end goal of this. It is not, as a general rule, to torture children. It is not to make inconvenience lives of kids and parents. It is purely just to keep as many kids in school as possible. And I'll finally just kind of end with one of the other ways that we can do that is through vaccination. We are a very, very special place in Albemarle County because our vaccination rates are so incredibly high compared to the rest of the country. nearly to the degree with the Delta surge as we've seen in other parts of even the state or other parts of the country. I would continue to encourage you, if your child is above 12, to go out and do that. If you have questions, I am always available to answer those. Your pediatrician is always available to answer those. But please know that the availability of vaccination will reduce the likelihood of causing your child to have to quarantine, reduce the likelihood of being able to actually catch the disease, and much more importantly, again, keep your child in school as much as possible. Again, please do not hesitate to reach out to me directly, your pediatrician, if you have questions about the vaccine, and we're happy to talk about that further.
Thank you so much, Dr. Vergalis. That was really helpful, and we really appreciate your input and you being here. So Dr. McLaughlin, if you're ready.
Yes, thanks, Helen, and thanks, Dr. Vergalis, for being here, and thanks to all of you for coming out tonight. I really appreciate you taking the time to come listen and get your questions answered, and hopefully we can get to all of those. So as Helen said, my name's Pat McLaughlin. I'm the Chief of Strategic Planning for the school division. And tonight I'm going to give you an update that was very similar to the update we gave to our school board just last week. That'll start with kind of the current state of COVID in our county, in Albemarle, our guidance from the Virginia Department of Health and the Department of Education on how we should make our operational decisions, and then get into some more details about our specific mitigation strategies as we get the year started on Monday. So the guidance that you're about to see comes from both the DOE, the Virginia Department of Health, in a collaborative partnership to consider how we should make operational decisions in schools. And this has been updated recently because the decisions in here used to be not how do you make operational decisions, but whether or not you open schools. So now we know that all schools are open 5 days a week. All public schools are going to offer 5 days a week of in-person instruction to all students. So these guidelines will help us make operational decisions. And the first of these steps is to evaluate the level of community disease transmission in your area. And the level of community transmission is determined using a couple of measures. The first is the total number of new cases per 100,000 people in the past 7 days. And the most recent data in our current 7-day total is that we've got 100.61 cases per 100,000 people in the last 7 days. And that puts us in the high transmission category that's over here. The second measure that they ask us to look at is our percent positivity. That is of all of the NAAT tests that are given in the community, what percentage of them come back positive in the past 7 days. And our latest percent positivity is 5.51. And that puts us into the moderate transmission level for percent positivity. And so we've got two indicators that are at different levels. And when we have that, the Virginia Department of Health recommends using the indicator that has the higher value to assess our community transmission level. So currently our transmission level is at the high level. And you can see we've really been fluctuating between that high and that substantial level almost on a daily basis. You can see that our number is right here, just half a point over the threshold to get into high, but we've really been hanging in there, which is a pretty significant increase from where we were just about a month and a half ago, where we were seeing 10 or fewer total cases in the district on a weekly basis. So our community transmission level is high. And then the second step is to understand the community level of vaccination coverage. And that's, as Dr. Vergalis alluded to, some really good news comes in. Our community vaccination levels among eligible school-age students is one of the higher that we see in the state. When you look at our 12 to 15-year-old population in Albemarle County that have at least one dose of vaccine, they're at 79.6%. Our 16 and 17-year-olds with at least one dose are at 84.1. When you break that out to the kids who are fully vaccinated, those numbers are encouraging as well. The 12 to 15-year-olds are at 69.9, and the 16 and 17-year-olds are at 76.5. Those have gone up just since the last time we updated the school board by about a percentage each. So folks are still out there getting their vaccinations. So step number 3 in the decision-making process is to consider the level of impact that the virus is having in our schools. And when we do that, we look at a couple of things. The first is transmission within the school, meaning, are we seeing cases that we can trace back to the school where one student caught it from another person in the school, or a teacher caught it from another person while they were in the school? We refer to that as an outbreak. And so it's got 3 levels: low, which is no cases or very sporadic cases with no evidence of transmission. Medium is where we have an outbreak, but it's a very small scale. And then high is when you've got multiple outbreaks there. They also ask us to look at student absenteeism in terms of COVID, right? Because of the pandemic, are we seeing different levels of absenteeism than we would normally see in a year? And we're asked to look at the same thing for our staff. Is our staff able to come in, or is COVID impacting their ability to come to work? This we don't have a current level on because schools haven't opened yet. So when schools open on Monday, we'll begin watching this as one of the metrics, and we'll be reporting out to the board on a regular basis about that. Step 4 is to understand the community, the capacity and needs of our community. And the VDH advises for this, that schools should prioritize providing what they call safety optimized in-person learning environments. And schools will need to assess the feasibility of certain prevention strategies to help decide what combination of mitigation strategies is best. And our teams are continually examining our capacity and our needs and our layered mitigation strategies. And those layered mitigation strategies really are the 5th step in this operational decision-making process. The VDH recommends that all schools and school division work with local public health departments to assist in determining the prevention strategies that are needed. And almost since the start of the pandemic, we have had a partnership both with the Blue Ridge Health District and a group of local medical professionals who have been advising us on a weekly basis in terms of what they see and what the best ideas are for mitigation. And you can see these 9 prevention strategies that are outlined over here: promoting vaccination, consistent and correct use of masks, physical distancing, screening testing, ventilation, hand washing and respiratory etiquette, cleaning and maintaining healthy facilities, staying home when sick and getting tested, and contact tracing in combination with isolation and quarantine. As you'll hear later in the presentation, when we talk about our mitigation strategies, we've got just about all of those in place. The one exception that we have is screening testing. And as we've talked about screening testing with our local medical professionals, we've really been advised that it would have a very limited benefit in containing the spread of the virus. And so we've got, as we think about this sentence over here, this guidance over here, work in cooperation with your local public health departments, that's exactly what we've been doing to determine our mitigation strategies. So let's talk a little bit about, that's the kind of the current state of where we are. Let's talk a bit about what school is going to look like and what our mitigation strategies are going to look like as we head into next year. So as I said earlier, the mitigation strategies we have in place are based on guidance from national, state, and local level. And we continue to partner with the Blue Ridge Health District and those local medical professionals on a regular basis to stay informed of any changing guidance on the levels of community transmission. Daily COVID-19 screenings are going to be the first step in our process. Every school day, parents are responsible for completing an at-home health screening of their child for COVID-19 symptoms prior to allowing their child to board a school bus or to enter a school building. They've got a series of questions that they go through, and if they answer yes to any screening question, they must keep their child home and notify the school. Employees do a similar process. They're also required to perform a self-assessment for symptoms of COVID, and if they answer yes to any screening questions, they must stay home and notify their supervisor. And finally, visitors are required to undergo a health screening for COVID-19 when they enter the building. And if they answer yes to any screening question, they won't be granted access to the facilities. We continue to require masks to be worn by all students, employees, and visitors when inside our school building or on our school buses, regardless of their vaccination status. You likely know that the governor just put out a mandate around that as well. So in our buildings, we are going to maintain a distance of at least 3 feet between students. A greater distance, at least 6 feet, will be maintained when students are participating in moderate or vigorous physical activity, singing, or playing a musical instrument. And while outdoors, distance will be increased as much as the activity and space allow, and as often as possible, we'll maintain a distance of at least 6 feet between adults and students. Hand hygiene is another key strategy, and students are required to wash or sanitize their hands frequently during the day. Minimally, this includes each time they get onto a bus, enter a room, go outside for recess, and before they eat. All building entry points, classrooms, cafeteria, and buses will have hand sanitizer dispensers to promote and support this requirement. Throughout the day, custodial staff disinfect high-touch surfaces. At night, custodians clean and disinfect classrooms and other spaces that were in use during the day, and disinfecting wipes are available in all occupied classrooms for use by students and employees to sanitize high-touch surfaces periodically throughout the day. We have made significant investments in improvements to the ventilation systems that are in our school facilities. Whenever possible, we've installed upgraded air filters and adjusted our mechanical systems to increase airflow from the outside. Every day, in an effort to improve indoor air quality, we perform a building flush both before school and after occupancy that takes out all of the air and replaces it with new. We've also placed air purifiers with high energy particulate filters, HEPA filters, in our classrooms, clinics, and school buses. Each day, every school day, breakfast and lunch are going to be available to all students free of charge, regardless of their income level. Breakfast is available upon arrival, and students will eat breakfast in their classroom. And lunch is served primarily in the cafeteria, though larger schools may set up additional serving lines elsewhere. Depending on the school and grade level, students may eat lunch in a cafeteria, a classroom, or another designated area of the building or outside. We really encourage eating outdoors when the weather permits and if adequate supervision is available. But whether indoors or outdoors, we maximize physical distancing to the extent possible, maintaining a minimum of 3 feet between students. And once they are seated and ready to eat, students are permitted to remove their masks. For contact tracing purposes, elementary students sit with the same group of students for at least 1 week at a time. And middle and high schools have a system they're using to track where and whom students are eating with. So transportation is going to be a little bit different this year because school buses are back to operating at normal capacity. Every bus in our fleet has a HEPA filter that's been installed, and they're located on the ceiling near a few rows behind the driver. They remove dust, pollen, and virus particles from the air, and we turn the filters on whenever the windows are closed. So on buses without air conditioning, we open windows during warm weather and turn off the HEPA air filter. During cold weather, we'll close those windows and turn the HEPA filter on. On buses that do have air conditioning, we keep the windows closed and run the HEPA filter at all times. As we said earlier, every time a student gets on the bus, they must sanitize their hands. The bus driver and all riders must wear a face mask, and each bus is going to have a supply of masks in case someone forgets theirs on the way to the bus stops. The seats and the handrails are disinfected daily, and everyone's going to have an assigned seat that will help us with contact tracing should we get a positive case. We mentioned visitors a little bit earlier. All visitors to our facilities have to undergo that health screening that we mentioned. And approved school visitors must sign in through the visitor management system in the main office and receive a volunteer or visitor's badge. They are not allowed in classrooms during the school day, and they must wear a mask and keep at least 6 feet of distance between themselves and students. So during the school day, visitors are limited to those who are volunteering, attending a meeting, or visiting for another purpose approved by the principal. In addition to these safety measures, there's a few other things that we'd like to share with you tonight. One revolves around field trips. We have a central committee that has been formed to review any field trips or extracurriculars activities in advance to make sure those would be safe to allow. All of our water fountains in our schools are turned off, but the bottle filling feature of those water fountains are available. And we really encourage all students to bring their own water bottle to school so they can make use of those. We are in the process of having outdoor tents installed at each school to promote more students being outside. And we are going to limit the sharing of materials and equipment. Students will have individual classroom supplies, which is different than years past, particularly at our elementary schools, where all the glue sticks got put in one bin and all the pencils got put in one bin. Every kid will have their own this year. And if all the mitigation strategies described above, such as physical distancing and masks, are in place, we will not have to place any additional restrictions on things like assemblies, large gatherings, or community use. One final note, just recently at the last school board meeting, it was announced that all Albemarle County school employees have an expectation to be vaccinated or to have weekly COVID testing completed, and that will be starting September 15th. So what happens if we do have an illness at school, or if we have an employee who is ill? So if someone develops COVID-19-like symptoms while they're at school or work, they'll be excluded from school or work and referred to a healthcare provider to see if COVID-19 testing is warranted. If a student becomes ill at school, we'll notify the parent or the guardian, who will need to pick the child up promptly, hopefully within 60 minutes, and the student will wait in a designated space until that time. Before a symptomatic student may return to school, we've got a return to school form that must be completed by a healthcare provider. Fully vaccinated individuals do not need to quarantine following a known exposure, provided they do not develop symptoms. If a fully vaccinated person does develop symptoms, they should seek a medical evaluation to see if testing is warranted. And in general, people who are considered fully vaccinated, once they have 2 weeks after their second dose in a series such as Pfizer or Moderna, or 2 weeks after the single dose of the Johnson & Johnson vaccine. Finally, if we need to close a school, the superintendent of schools, in consultation with the local health officials, will make that decision. The factors that Dr. Haas will consider are the extent of an identified outbreak at an Albemarle County facility, the COVID-19 conditions in the community, absenteeism rates among staff and students, and local or state ordinances that are in effect. So if needed, individual schools will temporarily transition to fully virtual instruction for a length of time determined in coordination with the local health department. Such a decision would be based on the number of cases in the school and evidence of transmission at that particular school. We're hoping that we don't have to get to any school closures this year, but we are going to have school closures be targeted. So hopefully we don't have to shut down the entire division unless conditions really deteriorate. We get guidance from public health officials that is something we would need to do. And so we're currently developing the plan for how that transition would occur if we need to use it. So that is the kind of a concise version of the information that we have available to us right now about our COVID-19 mitigation strategies. I have a feeling there's probably been a few questions that have come into the Q&A session since we've got started. So I think Helen is going to start looking through those, and we'll get to as many as we can in the time that we've got remaining.
Thank you so much, Pat. Yeah, we've had quite a few questions, and again, we're so glad that people are so engaged and checking in with us about these things. So the first question that we have is, if there is a positive case in school, will the entire school be notified? And if the whole school is not notified, will every child in the positive cases class be notified?
I'll take that one. There will be a couple of different notifications that will occur in the event of a positive case. First, anyone that's identified as a close contact, and we have that definition on our website, will, in most instances where practical, receive a phone call. We want to make sure the family receives that message as quickly as possible and is able to answer questions right away. After that, members of the entire school are notified every time we have a positive case. In addition to that, you will be notified if that case is in your child's class. So that's, again, 3 different notifications that will go out. A close contact, that student was in the class, and then a whole school. And I will add to that, though, that the identity of the individual will remain confidential.
Thank you so much, Rosalind. Next question, can you please address what factors, if any, would trigger a school shutdown in the midst of the Delta surge?
I'll take that one too. Dr. McGoughlin mentioned it at the end. There is we will primarily be looking at cases in the school, right? We'll be monitoring community transmission levels and this and that, but that decision factor will primarily be based on cases in the school or identified outbreaks. Again, it is our intention to be as open as much as possible. We will rely heavily on the direction of the local health officials, but that's the primary factor. You will see no mention of stages in any of this conversation for next year. And so our intent is that they would be very targeted closures and temporary.
Thank you. We do have one question in Spanish, and I I think I know what it's asking, but I want to make sure you've gotten the correct, I want to get the right answer to you. I hope that this individual is in the Spanish speaking room. So so I know Paula is on top of that. So we will I'll hold off on that for a second. Next question is, Dr. Patriello made it sound in a recent article that kids will not have to quarantine if masks are being worn during exposure. Does this only apply to vaccinated students or to children under age 12 as well?
Yeah, I could probably take that one. So the CDC and the American Academy of Pediatrics worked very closely over the summer to understand that since schools with proper mitigation strategies in place, that's a key statement there, which Albemarle County would meet that criteria, had an exception to what was defined as the close contact rule. And that meant that during indoor settings, if masking was being utilized and appropriately being utilized, that a case in a school would not be defined as a close contact with the other individuals in close proximity. We have a lot of research that suggests that in that situation, in an indoor setting with schools and other mitigation strategies, that is not where spreading is occurring. And so that is true for both vaccinated and unvaccinated kids. It's one of the reasons that we have emphasized the importance of masking as a mitigation strategy to keep as many kids in school as possible. And that if a case exists in a classroom in an indoor setting, and everybody is appropriately using masks, that we can have an exception to the close contact rule for that reason for all individuals. Not all individuals as students, not specifically staff members.
Thank you so much, Dr. Vergalis. What are options for parents who, if at any point during the semester, no longer feel comfortable sending children for in-person learning?
I can grab that one. I think we are still developing that process, but it will be handled on a case-by-case basis. And the first person to start with is your school principal. So if you feel like you need to change venue, talk with the building principal, and they will kind of walk through the process of what options may be available to your child.
Great, thank you. Let's see. We have SB 1303 takes us back to pre-pandemic full-time school schedule. Since the Delta surge, why aren't we keeping the virtual option open until our children are vaccinated? Parents may feel very uncomfortable now, more uncomfortable, I guess, now than we did at the end of July. I understand that resources may be a factor, but if school closes due to an outbreak, we will need to go to a virtual school option anyway.
So the virtual school, we did put a deadline on it, as many people know. I mean, that's out of practical reasons, right? We need to make sure that we are adequately staffed for the students we have, and making sure class sizes are managed and et cetera. That being said, there is a process, as Pat alluded to a little bit, that if somebody does feel like they have a compelling reason why they need to apply to that virtual school after that deadline, to contact that principal, and they will review it on a case-by-case basis.
All right. Is requiring vaccination for students that are eligible being considered? Will additional vaccine clinics at the schools be offered for both initial vaccinations and the recommended boosters?
I can probably take the first part of that. I won't necessarily be able to take the second, but requiring vaccination for children is a much more challenging endeavor than requiring it for adults. And so as of now, that would not be something that I've advised ACPS, and the other pediatricians advise ACPS for a whole variety of reasons. The hopes is that as more trials come out and that we can solidify exactly how vaccination works in all students, that we could move towards a similar concept of how we mandate other vaccines for schools, but that is not in the foreseeable future right now for a whole host of variety of reasons.
Will ACPS be implementing any sort of random testing throughout its schools? I know some other school districts around the country are with parental permission doing this to try to catch outbreaks before they happen.
I know Eileen and Jeff, I know we've been speaking about the testing protocol. Could one of you all speak to that maybe?
Sure. Eileen, you want to take that?
Well, I was going to say that we consulted with our medical advisors and the local health department, and they advised us against that because it really doesn't have a practical impact on the number of cases in the schools, and it often creates more problems than it solves. And Dr. Vergalis, could you explain that?
I can, and some of this is not just theoretical, but we have loads of evidence both within this state and in other child congregate care settings over the last 12 months that random testing within a school and a school district as large as ACPS would be incredibly challenging with a significant amount of resources to be able to generate. But much more importantly is that it won't really give us a significant benefit on a level like we have. And so this is kind of proven time and time again among child congregate care settings, and it's something that we've seen again, both in real time over the course of last year. And it's for that reason that we have recommended fairly strongly, and that's been medical professionals pediatricians time and time again have recommended fairly strongly against this. And we have the backing of the Blue Ridge Health District for this as well.
Thank you. How will promoting the vaccine help my 10-year-old? Follow up. Very interested to hear more detail around your contact tracing plan.
I think for the first part, promotion of the vaccine is really for everyone, right? And I think the more people that are vaccinated in the community, the safer our children who do not have the ability to be vaccinated become. I hope I'm not stealing your thunder there, Dr. Vergalis, and I said that right. But I think that's that's what we hear over and over, that when we can get that overall percentage of our community up as high as possible, that's going to benefit everyone. And then Helen, remind the second part of the question.
Very interested to hear more detail around your contact tracing plan.
I could take this one. In the schools, we have the school nurses working with the health department to do the contact tracing, and they talk with the teachers and determine which people in that class would be considered close contacts, and then the parents of those students would be contacted, and the children will be asked to stay home for the isolation period unless they're fully vaccinated. Fully vaccinated individuals will not have to quarantine, but they will have to monitor their symptoms.
And to support those efforts, we've put in other operation practices such as assigned seating on a bus and sign-in sheets if there's a temporary group sign-in sheets for special events. And so putting those structures in place so that contact tracing is as efficient and accurate as possible.
Dr. McLaughlin did a fantastic job with that piece. I've just add one final sentence, which is to say that please remember that we know that the vast majority of transmission to children under the age of 10 or under the age of 12 is coming from older children and adults. It is rarer, I should say, not totally rare, for it to happen in the reverse direction. Without a doubt, the higher the level of immunity within our community, the lower likelihood that you have children that are unvaccinated coming down with the illness. And I think that's probably the take-home point that has driven a lot of our policies this year.
So we're getting a few questions about why the September 15th deadline was created for the required vaccinations for teachers or the testing.
I can take the beginning of it. One of the reasons was that the resolution that was passed by our school board adopted the order of Albemarle County, which established September 15th as the date by which all county employees and now ACPS staff must be fully vaccinated or commence testing. So by following the order of Albemarle County, which established September 15th, that's how we did it as well.
Thank you, Ross. Please clarify what masking exemptions will be honored. Our school has been told by central office that there will be no masking exemptions, which is against the governor's mandate. Is this accurate? If not, to whom should parents submit masking exemptions?
I can take this a little bit, but I may need some help on the instructional side. What we are doing is if a child cannot or will not wear a mask, we're going to have the most sincere conversation that we can have with the family, hopefully find ways that the child can wear a mask. But if that is not, if we can't reach that resolution, then under our procedure, we will offer the child a place in the virtual school. And that's what we did last year as well. And that will be a process continuing this year.
So we also have a question about, let's see, we've had a few people ask actually if there's a way to know whether their children's teachers have been vaccinated specifically, or if they can know the proportions of vaccinations in their schools.
I'll just take the first part, then maybe Roslyn the second. As far as there are privacy laws, both federal, the ADA and the FMLA that have privacy requirements so that we cannot disclose the medical information. And of course, vaccination is medical data. So that's something that we can't do both under federal law and under the Virginia Medical Privacy Act. With respect to general information as it's assembled, that's something that we could consider providing because it's not going to disclosing personally identifiable information, medical information about a particular teacher or staff member.
If quarantined, do students have the opportunity to access their courses and coursework virtually?
There is not a virtual option at this time for students who are home on quarantine. We would treat that as, as if a student got the flu in the past. And we feel the best way for them to stay on top of things is through direct communication with their classroom teacher and to have that work sent home to them from that person.
And to elaborate on that, the only exception to that would be in the event that the whole class is quarantined for whatever reason, and then the whole class would switch to virtual instruction.
So we have a question about, we have a couple of questions about KN95 and N95 masks. We've had a question related to requiring them or if we would provide them for teachers or I guess employees or students.
I can take the kid portion of the N95. So N95 masks are what we use oftentimes as kind of medical grade masks within the hospital. They're not really considered a mask. They're considered what's called a respirator. The importance of N95s is that they have to be actually fit to the individual, and they're very uncomfortable to wear for anybody who has worn one for a prolonged period of time. And so they don't really make them in children's sizes, especially the variety of sizes and shapes that kids' faces are. And so they're very strongly recommended against by most pediatric professional societies and hence wouldn't be provided from a kid's standpoint.
We do provide the KN95s for staff upon request.
We have a few questions about what is considered a close contact. The question says, from reading the information online, it appears that if a child sitting in a class 3 to 6 feet from my child was diagnosed with COVID, my child would not be considered a close contact if both were wearing masks.
That is correct.
We also have had a couple of people ask who's going to be doing the testing on staff who are not vaccinated, how that system is going to be worked and maintained.
We are still working out the logistics of that, and we'll communicate that to staff once it's finalized.
Will students be allowed to remove their masks when they are seated in a socially distanced space within their classroom? I think we've kind of already answered that, but.
Yeah, no, the answer is no. I think eating is probably one of the only times outside has some exceptions when we can distance, but at all other times we'll have masks. There are opportunities for mask breaks. We have designated areas in the school that if a student feels like he or she needs to take off his or her mask for a few minutes, they can go out and do that and then remask and come back to the classroom.
So the screening questions include things like fatigue and headache. If teachers experience these more common symptoms that can be non-COVID as well, and they stay home, will they be allowed to use COVID PTO rather than having to dip into their personal PTO? I also have had a couple of questions about excused absences for students. Will there be any added provisions for students who miss school in terms of their absences?
So I can speak to the student part. I'm not sure. So we don't have a limit really on the number of absences a student can have. There are some restrictions from the state in terms of consecutive absences. I think it's once you hit over 15, something like that. But everything has been dialed back with some exceptions for during the pandemic. So there is not a set number of absences that if a student hits that threshold is going to have any automatic negative repercussions on them.
And I'll take the staff question. This actually will be communicated to staff in the next couple of days. We're finalizing the details of it, but staff will be provided some additional leave that are for COVID related items, and the specifics of that will be shared in those details.
How many elementary students will be seated per seat on the bus? And can you provide more details about HEPA filters and how effective they are? Is it possible to request who they are seated, who I guess the students are seated with on the bus? And will they board the bus from back to front?
And depending on the route, there will be up to 3 elementary students in a seat. Helen, keep going on. I lost the rest of it. HEPA, I can't get into the technical details of it, but we can share that if anyone has specific concerns, please reach out to us. And then the last one was knowing who's sitting near a child.
No,
I will talk to the transportation department. In general, though, siblings will be assigned together. That will be a known entity, and we will not be loading front to back.
Thank you. So we're going to have time for one more here. And we do have many questions, but we do have to stop at 7:15. I will discuss how we can move forward after this. But did the school board discuss the idea of delaying schools for a few weeks until the Delta variant cases go downward?
I'm not aware of any discussions to change the start date of the school year.
Well, so we do have one more second. I think we can. We've had a few people ask about the justification behind eating meals, obviously with no masks on. There's no, you can't eat with a mask on, but a couple of people have asked about basically the science behind that.
So we clearly know as a general rule that we're trying to do everything we can to create mitigation strategies that reduce the likelihood of spread, but nothing can eliminate the potential for spread. And I think understanding about how in schools we spend a lot of time thinking about in lunch times and where kids sitting and how they're sitting and how we're identifying the known of who they're sitting next to is probably the most important thing. But at the end of the day, kids do need to eat. And they do need to, eat at points during school. And so I think individual schools are doing the best they can to spread kids out, but understanding that the kids have to eat. And more importantly, is that every mitigation strategy is going to have some holes present within it. It's very important, I guess, Helen, final up as That's why it's incredibly important that we are layering the mitigation strategies, as Dr. McLaughlin had pointed out. We can't just rely on just one individual one, in this case, masking, to provide benefit. It's very important that we rely on multiple mitigation strategies.
Well, I'm really happy to see how many people have joined us tonight. We've had a great attendance and so much engagement, lots of great questions. I just want to reiterate, I know we did not get to all of the questions tonight here, but we are going to, for frequently asked questions, we are going to keep the website updated. So I did add that into the chat for all participants. That'll be maintained constantly. We will work to get frequently asked questions up there, just added in the informational section. If you have further questions and you'd like to touch base with somebody directly, please feel free to contact me. Again, Helen Dunn at hdunn@k12albemarle.org. I will work with you to get all the answers that you need. And thank you again to our panelists and to everyone who's come to join us and find out more about our COVID mitigation strategies.